Hello, today we're going to talk about a very interesting topic, that is the oral symptoms of COVID 19. Now, COVID 19 is the disease that's caused by the most recently discovered coronavirus. Now, as this virus is fairly new, there is limited data available, and health professionals are still studying the virus. COVID 19 has wide ranging symptoms. Along with the common symptoms, there have also been reports about skin manifestations, oral manifestations, etc. So, usually the symptoms may be seen 2 to 14 days after exposure to the virus. It spreads via droplets of saliva and nasal secretions. So, now let's look at the common symptoms. Note that this is not an exhaustive list. The common symptoms are high temperature or fever, a new continuous cough. It could also be a dry cough, loss of taste and smell, tiredness, body ache or headache, shortness of breath or breathing difficulty, sore throat, diarrhea. Some of the skin manifestations that have been reported are rashes, discoloration of fingers or toes, they're now known as COVID toes, petechial rashes, redness of palms, vesicles, etc. Let's look at some of the oral symptoms. The most common symptom that has been reported by many patients is loss of taste or diminished taste. But fortunately, as one heals, the taste will also come back. The second symptom is ulcers or blisters. There could be various causes for ulcers or blisters to occur. I've got a separate video on mouth ulcers which you can check out to find out the different causes and how to treat them. So number 3 is petechiae. Now these are very small blood blisters. Basically they occur because of bleeding beneath the skin. It is caused due to the rupture of capillaries by repeated coughing or sneezing or even vomiting. Number 4 is dry mouth. Usually a dry mouth is seen when you have difficulty in breathing or breathing through your mouth. Number 5 is severe bad breath, again associated with respiratory complications. Number 6 is erythematous lesions like red rashes on your body, but it could also occur on your face. Number 7 is herpetic lesions. These can occur if your immune system is weak, so they can get triggered off. An example for this is cold sores. Number 8 is inflamed or bleeding gums. It is still unclear why these symptoms occur, but these are some of the possibilities. 1, it could be a drug reaction. So some drugs do have side effects, so you could break out into a rash, and that could be one explanation. Another reason is that it could be an opportunistic infection. This means that certain germs just make use of the opportunity of having a weakened immune system. A common example is fungal infection that is seen on the tongue. Or maybe it is just another symptom of COVID 19. Now, this is still unclear, so we just need to wait for more data for us to get more clarity on this. Now, a few points to note. Now, just because you have an oral lesion, say an ulcer, it does not automatically mean that you have COVID 19. Okay, but if you test positive for COVID 19, then it's advisable to have a full mouth examination at some point. Now, these symptoms are not definitive diagnosis for COVID, they only aid in the diagnosis. So make sure that you don't stress about having an ulcer or a cold sore or just a dry mouth. If in doubt, it's best to get advice from a healthcare professional as soon as possible. So in short, just make sure that you do not take your oral health for granted. Maintain good oral hygiene. Try and wash fruits and vegetables thoroughly before consumption. Eat a well-balanced diet. Ensure that you're getting enough vitamins. Vitamin C especially is good for your gums. Also, don't forget to clean your tongue, as your tongue can also harbor loads of germs. Hope you found this video useful. Take care, stay healthy, and stay happy. See you in the next video.